Trump wants RFK Jr. to go wild on healthcare. Investors need not panic. Sunday's photo of Robert F. Kennedy, Jr. sharing a McDonald's meal with Donald Trump aboard Trump Force One may prove to be an early indicator that the journey to make America healthy again might be full of contradictions. Make America healthy again starts tomorrow, joked Donald Trump Jr. in a post on X sharing the picture. While it is hard to fault Kennedy for indulging in a Coke and fries, the image underscored the odd pairing between Kennedy, who has expressed skepticism of America's big food industry alongside vaccines, and Trump, a well-known fast food enthusiast, who has boasted about the rapid development of COVID-19 vaccines during his first administration. Some of Kennedy's stances, like critiquing the cozy relationship between government and corporations, find more resonance with certain factions on the left than with Trump or the broader Republican Party. Moreover, unlike Trump's priorities of slashing taxes and imposing trade tariffs, the president-elect has shown inconsistency on healthcare reform. His first-term efforts to target drug middlemen and overhaul Obamacare stalled, and he recently retreated from a controversial drug pricing plan. Kennedy's plans, should he be confirmed by the Senate as Secretary of Health and Human Services, are far from sure to be realized. Already, early signs of potential division within Trump's team have emerged. Kennedy is pushing for the Food and Drug Administration to be tougher on Big Pharma, while Vivek Ramaswamy, whom Trump appointed alongside Elon Musk to lead an effort to cut federal spending, argued last week on X that the FDA is too restrictive, creating unnecessary barriers to innovation. This raises the question, could Ramaswamy, who made his fortune as a biotech investor, find himself whispering in Trump's ear to ease up on drug companies? And would Trump support Kennedy-favored policies that might cause biotech and pharmaceutical stocks, such as Amgen and Merck, which are two of 30 components of the Dow Jones Industrial Average, to plunge even further? The market, it seems, is bracing for backbreaking measures targeting Big Pharma, while seemingly forgetting that it was Joe Biden who signed a law empowering Medicare to negotiate drug prices directly. Last week, when Kennedy's nomination to the nation's top health position was announced, investors in pharmaceutical stocks fled the scene. The NYSE ARCA Pharmaceutical Index has dropped almost 5% since the news leaked last Thursday, while the SPDR S&P Biotech ETF has seen losses of nearly 10%. Near-term choppiness is to be expected, but large-cap pharma companies are now trading at about a 35% discount to the S&P 500, as measured by their forward price-earnings ratios. The discount is even larger, about 45% to 50%, if Eli Lilly, maker of a blockbuster obesity drug, is removed from the group, Chris Schott, an analyst at J.P. Morgan, notes. While the cloud of uncertainty could persist for a while, he says the potential for upside outweighs the potential for additional downside, especially for longer-term investors. There is, of course, reason for concern. As Secretary of the Department of Health and Human Services, Kennedy would oversee 13 operating divisions with more than 80,000 employees, including the FDA, the National Institutes of Health, and the Centers for Disease Control and Prevention. He has proposed ideas such as revising direct-to-consumer pharmaceutical advertising guidelines and capping drug prices, policies that the industry views as a worst-case scenario. Mani Foroohar, a biotech analyst at Leerink, notes that placing an industry critic in such a powerful position introduces unpredictability. However, it is unclear whether Kennedy could enact the types of changes that would significantly impact the industry's profits, partly because it is uncertain if he would have the authority to appoint his own leaders for divisions, such as the FDA. The scale of complexity of the FDA means that implementing sweeping changes across various policies will be anything but easy, Foroohar says. Evan Seigerman, an analyst at BMO Capital Markets, writes that Trump may wind up appointing an FDA commissioner with industry ties, as he did during his first term with Scott Gottlieb, currently a Pfizer board member. If Trump's first term is any indication, investors shouldn't expect drastic changes in healthcare, largely because these reforms are complex and involve trade-offs. For example, if Kennedy were to limit the approval of a certain drug or lobby against Medicare coverage of GLP-1s for obesity, it could upset swaths of the public. Instead, Trump might steer Kennedy toward focusing on areas such as nutrition rather than drug approvals.